we're tackling a public health crisis, essentially from within a construct of limited resources. And being able to solve problems like that goes beyond simply showing up to work, punching a clock, saying next, to the next patient. The one thing I realize you have to ask every patient is, hey, so while you're here, what else can I help you with? Are you out of any medications? Do you need refills on any medications? How are you going to get to your clinic appointment? Do you have a car? Do you know someone that has a car? Do we need to arrange the CHR transportation van to come get you to that appointment? And so if you don't slow down and talk to folks, you're going to start missing things. I had a patient one time that was just waiting on a ride to be discharged home. And so I did my usual thing, hey, is there anything else I can do to help you? And the guy said, well, I don't really know where I'm going after I leave here, which is kind of a big problem. And the guy looked like he was wasting away too. So I asked him a few questions. I said, well, I when I was younger, I drank drain opener. I destroyed my esophagus and part of my stomach. And I got this feeding tube, and I was in jail for the last 2 years, and they were taking care of me, but I don't even know where I'm going to get my feeding tube supplies from. And I don't have health insurance, and I don't have Medicaid, and I'm not living on the reservation. So when I end up back in this other place, I don't know how I'm going to get care. And so I provided this guy with tons of insure, and I got the social work department out to help him process a Medicaid application. We got CHR involved to give him a ride and found a shelter for him, and then contacted the Mission Medical Clinic in a nearby town for follow-up. And so just handing the guy the prescription wasn't really the solution to his problems. You have to recognize that we have to do things differently, and we have to push harder because this is a vulnerable population.